Hello, my name is Teresa Stack, and this learning unit will cover the basics of the ISO standard 45001 2018, and it's one of the international standards for occupational safety and health. And by far, it's the cornerstone of the occupational safety and health management system. And so our goals here are for you to be able to understand the 10 different elements inside of the ISO standard so that you can implement as many of these as possible, even if you're not formally implementing the ISO standard. And it has been around for quite some time, and it does, in a sense, supersede the OSHA standard in that it's much more comprehensive, as well as a number of organizations have already adopted it. And so this simple this simple graphic is one that brings the different elements all into context. So you have kind of this outer ring, which is the context of the organization, that's going to be doing the plan, do, check, act model. And leadership, as well as worker participation, is the core, and that's that center that you see there. And then you have these external and internal elements that lead into the ability to be successful in your management system, as well as what their requirements would be. And at the bottom, this performance evaluation, this is our check, but this is where we go ahead and see whether we're meeting the goals. So I think it's good to start with some data. This is being recorded in July of 2023, and this was the most recent injury and illness data that I can find. And fatalities are up almost 9% from 2020. So that's 5,190 people lost their lives in the United States last year. And employers report 2.6 million injuries and illnesses in 2021, and that's down 1.8% from 2022. But the decrease in injury and illnesses is nowhere as offset as the what I consider a huge increase in fatalities. Now, some people would argue that in 2020 we didn't have as many people in the workforce because of COVID, and that may be true. However, if we look at the trends from 2018 to 2021, there is a slight decrease, but then it's dipping back up again. So we're kind of reaching our pre-COVID goals, and boy, we really don't want to do that. And having a system in place, so since the course that this is being recorded for is system safety, this is the systems part of that safety. Having a process that has been accepted and tried a number of times and could be used to elevate the safety and health inside of your organization, or maybe just within your working group. So one of the unique features of the ISO standard is that it is flexible. It can expand and contract with the size of your organization through different processes within your organization or to meet your organization's needs. And they use the word conformance instead of compliance. And there's really a slight difference if we look at the different definitions of the word, but it's more related to performing within the intent of the standard instead of meeting the letter of the standard. And this is where it gives you and your company some flexibility in how you're going to enact each part and how much energy is going to be put into each part. Some of the benefits of the ISO standard are, of course, it's the same as implementing occupational safety and health anywhere, right? First, this morality, it's the right thing to do. Less work-related injuries and fatalities, which of course increase our profitability, as well as by decreasing our overhead. But also, if we implement this system of can do, checked, act, we may actually increase our productivity, which helps to increase our profitability by decreasing our error rates. And by meeting the goals of the standard, it increases our reputation or our value to our business line or our other customers. And it requires broad buy-in. So it's not just the occupational safety and health people pushing every day to have job safety hazard analysis done, and accident investigations done, and tailgate safety meetings done. It is bringing management together, as well as human resources and engineering and process control, to having a look at how to best enact this within your specific organization, giving the resources that you have available to you. Now, I am personally a big fan of performance-based standards. You still are, in a sense, checking all the box that you have the required elements, but you're implementing in the way that works the best for your organization. A university may operate differently than a company such as Boeing Commercial Airplane, and it might operate differently than state entities such as the Department of Transportation. However, we're all trying to seek, of course, the same goals. But using the standard allows you to consider strategically what's going to best work for your organization. And the benefit of it is having this systems approach to provide a safe and healthy workforce, also enable occupational safety and health to have more visibility by bringing leadership into the game if they aren't already. It is an upgrade, in a sense, to the OSHA standard 18001, but if you already have that implemented and it's working good for you, maybe you just pull a couple of different elements into there. What I like about this particular standard, as well as any type of structured organizational review, is that it improves your relationships with stakeholders by bringing the stakeholders into the safety and health conversation. And so there's 10 parts to the standard, and the first 3 parts are kind of not as important as the rest of them in this discussion. I mean, they're still important in the definition of worker, workplace, risk and hazard. And I think it's important to note that, the worker is anybody performing work, and the workplace is anywhere that work is done. So, for example, in the Department of Transportation, if we're out on I-90, that is our workplace. So there are 10 different parts. Part 1 is the scope and intended outcomes. Part 2 is not applicable. Part 3 is the definitions. And here's something that I think is really kind of unique is, again, they use this difference between conformance and non-conformance versus compliance and non-compliance. And this enables you to put your own standards, elements into the system itself without being in compliance or out of compliance. Part 4 is really important, and most of the diagrams that you'll see are based on this part 4, and that's the context of the organization. So if we go back to this slide, you can see that everything that we do inside of our circle, plan, do, check, act, as well as within the scope of the management system, is the context of the organization, right? So how are we defining our organization, and how is it best that we modify, massage the system to meet the context of our organization? Now, I am personally a big fan of performance-based standards. You still are, in a sense, checking all the box that you have the required elements, but you're implementing in the way that works the best for your organization. A university may operate differently than a company such as Boeing Commercial Airplane, and it might operate differently than state entities such as the Department of Transportation. However, we're all trying to seek, of course, the same goals. But using the standard allows you to consider strategically what's going to best work for your organization. And the benefit of it is having this systems approach to provide a safe and healthy workforce, also enable occupational safety and health to have more visibility by bringing leadership into the game if they aren't already. It is an upgrade, in a sense, to the OSHA standard 18001, but if you already have that implemented and it's working good for you, maybe you just pull a couple of different elements into there. What I like about this particular standard, as well as any type of structured organizational review, is that it improves your relationships with stakeholders by bringing the stakeholders into the safety and health conversation. And so there's 10 parts to the standard, and the first 3 parts are kind of not as important as the rest of them in this discussion. I mean, they're still important in the definition of worker, workplace, risk and hazard. And I think it's important to note that, the worker is anybody performing work, and the workplace is anywhere that work is done. So, for example, in the Department of Transportation, if we're out on I-90, that is our workplace. So there are 10 different parts. Part 1 is the scope and intended outcomes. Part 2 is not applicable. Part 3 is the definitions. And here's something that I think is really kind of unique is, again, they use this difference between conformance and non-conformance versus compliance and non-compliance. And this enables you to put your own standards, elements into the system itself without being in compliance or out of compliance. Part 4 is really important, and most of the diagrams that you'll see are based on this Part 4, and that's the context of the organization. So if we go back to this slide, you can see that everything that we do inside of our circle, plan, do, check, act, as well as within the scope of the management system, is the context of the organization, right? So how are we defining our organization, and how is it best that we modify, massage the system to meet the context of our organization? So part 4 is where much of the discussion takes place, and you define your stakeholders. Is that management itself, process, quality control, operations, human resources. When I was supporting the Department of Transportation, we had maintenance as well as equipment, and then we had planning and different areas, which would be the context of the organization. And this leads to leadership discussions as to what ultimately their outcome would be in the level of involvement. And it takes involvement from leadership, as does anything, or you're just constantly pushing. You define your objectives, your needs, your expectations, the scope of the occupational health and safety management system, and what policies are in place or what policies need to be established to ensure that you're able to implement the system. And so there's different ways in which you could kind of define your system or the context of your organization. And no matter what type of analysis that you perform or what kind of acronym you're going to use when you perform your analysis, basically you're looking for the gaps. Where are we and where do we want to go, and what's this gap in between? And what are our external factors that may push down on us? An example of this that I could give is that in Boeing commercial airplane, we always had big Boeing putting in place on us our delivery when we're supposed to deliver certain parts. And if we were late, it slows down the entire crafting or building of an aircraft. And therefore, that's an external factor that pushes down to our little Boeing who's building landing gear, right? And then we have our internal factors. So an example of an internal factor would be people who are maybe out sick or on vacation or who leave, and therefore they're not qualified to run a certain piece of equipment that needs to be running to make sure that we meet our deadlines, right? So we have our internal factors and we have our external factors. And definitely, I don't like to always bring up COVID, but boy, it was definitely, to me, one of those slaps in the face that look at how things can change overnight when we have our supply chains basically being cut off, as well as not our human resource. So here is the system diagram. Plan, do, check, act. And the numbers that you see here on the graphic are the sections of the ISO standard that apply. So we have our leadership and our worker participation, which is in the middle. It's the heart of it. And that through their interactions, we plan and then we check, right, through our performance evaluations. And this also includes, which I think is really interesting, professional development. So if you don't have professional development, you can't improve as a safety and health professional, or and it could be professional developments for your workers as well. Maybe they need to learn a different software program or gain some extra skills to be able to improve, to decrease the likelihood that they're going to be injured. And then support and operations of your system, so this isn't support and operations within your company. And the improvement that takes place, plan, do, check, act. And so this is all part of the context of the organization, where we begin by defining our expectations and identifying those interested parties that are going to take place in our system. And if you're in a smaller organization, for example, when I was a professor at Montana Tech, we really didn't define who was going to be part of our review process. Everybody had to take part in the review process because we had so few people that we only had 2 professors on each of the different tiers in which our evaluation would take place. But in a bigger organization, you may have some more latitude. Unfortunately, sometimes it's always the same people who commit, and it's nice to get new people to commit. So for Part 5 discusses this management and leadership and worker participation, and it gives 13 specific commitments that will help make the plan, do, check, act part run smoothly. And if it does, then we're continually improving, right? So this is part of this lean engineering methodology. And again, it's the same type of graphic with each area defined. And so in our planning phase, we identify our external and our internal stakeholders, needs, as well as barriers that may be put into place. And this helps us develop our management system. Occupational safety and health, we're definitely always part of this implementation. We are part of the training, and we're part of, that's going and checking, making sure that people are doing what they need to do and going back and modifying along the way. Part of the do that's in the ISO standard that's like specifically defined is this emergency preparedness and response plan. And this is because, of course, if we don't have this in place, any type of incident can completely take us down. And so we're not only checking that us as occupational safety and health professionals are doing what we say we're doing, but are those key management elements, are they meeting their objectives that enable us to do our job and the workers to participate? And then we improve by collecting data, evaluating it, and seeing where we're going to go from there. I really like the cleanness of this continuous improvement cycle. And I'm sure that you've used it in other elements. It's just a way to put it into the system safety context. So worker participation is so important. And anybody who's worked in lean manufacturing recognizes this. It was the heart of the Toyota way, was that, there's, if you're leaning, you could be cleaning. But they were thinking, if you're leaning, you could be thinking of ways to improve the system. And the worker knows how to do their job better, and the barriers that are in place than anybody else, unless you were a former worker. And so we have to have that two-way communication. And that involves non-managerial staff and support, those frontline workers. And this will help to remove our obstacles and then identify and provide the resources. Resources, not only the money, but the time, training, and information, so that it could make workers aware that they have the ability to make a change by putting suggestions in place. So they need a process, and that's the system safety process. And that if you ever had a opportunity where a worker needed to stop work, that they wouldn't be reprimanded for it, and that they're part of the solution. And people are more likely to succeed when they recognize how they're part of the bigger goal. How are they working to enhance safety and health in your operation, as well as really how do they fit into the bigger good? So I'll go back to Boeing Airplane again because it was interesting. One worker said to me, it'd be great if they just land or enable us to, maybe win a safety award and go see how the 747's being built. I've never actually even seen one before. And that would help them see how their small part in creating this landing gear creates the bigger goal of the airplane. People need to understand how their little pieces and parts go into the better good of the organization and the whole of whatever it is that you're trying to create or manufacture. So this leadership commitment is ensuring that you're integrating the different business processes together and providing the right resources to get the job done, whether it's time, training, money. And we do this mostly in the planning stage. And this helps safety and health make decisions and market their decisions to the next level, to the workers as well as to management. And then we integrate these roles and responsibilities into the roles and responsibilities in which they already have. And this is where safety and health has to be a core part of your business model, because if it isn't, people are just doing the walk without really understanding why they're doing it. And we communicate our plan and we agree on our expectations. Of course, as safety and health professionals, we're doing our risk assessments and our training and our instruction. And then we're going back and they're making sure that this is all part of this check and act, right? So we check, we find out what we're doing right. We keep doing it that way, maybe make small improvements, and then we find out what we're not doing right and how to make some corrections. And so there's different parts of the ISO standard that are directly related to what management's responsibilities are, what worker level responsibilities are, and what occupational safety and health responsibilities are. And what we're trying to do is we're trying to build this culture. So we have this idea of a climate and a culture. And a climate is what happens every day, where the culture is all the way around. It's almost like where you live, right? So you have different climates in wherever you are. So maybe you're in Idaho and you have summer, winter, spring, and fall. And so that's your climate. And it changes all the time. And your safety and health climate, as well as the mentality of management, changes. But how you build that culture, right? Your environment that surrounds that climate. And we do this by providing the necessary resources, keeping moving forward, informing the process, maintaining the documentation and the records so that we could see where we're going. Part 8 has two different subparts. It has two different subparts, but I really see it as three, but it really only has two. And something that's important in there is that it notes that you have to adapt the work to the workers, or change the work so that the workers are able to do it. And this is human factors and ergonomics. It means that we need to know something about the capabilities of the worker doing their job and change the job to meet the worker's capabilities, whether that's providing tools and equipment or training or administrative controls. So part 8 has to do with operational planning and control. And then again, we have this emergency preparedness and emergency response. And we do this as safety and health professionals anyways, but it's highlighted here more so than other things. I mean, as well as doing your job hazard analysis and your risk assessments, this is highlighted inside of the ISO standard, as well as your emergency response. And so part 7 and 8 is part of this interchange between planning and then doing, right? So we plan it and then we do it. And this is where we have our support, both from management and through operations itself. And so part of the do part of the cycle, there's different chapters within the book that can help you if you're not already doing them in your job, right? So if you don't identify hazards and conduct risk evaluations, we can find this in Chapter 4 and 5. And then, of course, the preferred order of hierarchy of controls, we'll find this in Chapter 13. Different hazard analysis, right? So we talked about these where we have this process analysis, that we do more of our HAZOP or our failure mode and effect analysis, which is getting down to the nitty-gritty of our process, not process, but specific task analysis. And then looking at investigating the causes of occupational injuries and illnesses, as well as accident investigations, training, and then emergency preparedness. So the book can help you in other ways besides the system safety, and that's where all this do comes into place. And so us as occupational safety and health professionals, we still bear the burden, but we need management commitment. And having a structure will help us communicate this to management much more clearly in the language that they want to see, which is so important. So we've identified some goals. Maybe we did this based on our data. A goal at the Department of Transportation was to decrease what they call ergonomic related incidences, and that's musculoskeletal disorders. Because ergonomics is actually the solution. We don't want to say ergonomic injuries, but musculoskeletal disorders. And we drilled down where we have in our problems, slip, trips, and falls, and manual materials handling. So we put some tools in place, we put some training in place, and then during the performance review, which is not just did we decrease our work-related musculoskeletal disorders, but are they using the training and the tools that we gave them, we're able to gather some more data, make some informed decisions, and go back around into our loop. So it's really important to have these performance evaluations, and it also, I think it helps you identify what new thing you may need to learn to be able to better implement your management system. And so there's 3 parts of this performance evaluation, and before you get to this point, of course, you decide what is it you're going to monitor and how you're going to monitor it, how you're going to disseminate your findings and take corrective action, and then which part of management goes in there and does their review. And that's really an important element. I collected a ton of data for our performance review in our insurance binder for the Department of Transportation that looked at where our property losses were. And before I was able to submit it to our insurance provider, I had to sit down with management and present that to them. So it's one thing to collect the data, but it's another thing altogether to present the data to higher level management, get their feedback and how you're going to make that change over time. And so this has you look at how well are you doing in your occupational safety and health management system, data collection, review process. Are you implementing the changes that need to be there? Do you have the resources available? Or are you so strapped with doing accident investigations that you don't even have a chance to do this? What are your opportunities to make changes? And then how can you implement these changes in your organization? And so then the last part is your improvement. And this feeds back into your action. This is what I need to improve. This is what I did improve. So what actions will I take to move the needle just a little bit every time? So it's definitely a lean engineering or a Six Sigma. There's different terms that are used. Boeing had their Boeing production system. But it's all based on the same types of ideas, and it's all based on Deming's Plan, Do, Check, Act. So we have external and internal monitoring, and I really like the ability to use this external monitoring. Over in Montana, the Department of Labor and Industries can come in and you can request a consultation review, which isn't an audit, and it's similar to an audit in that they go in and they take a look at your processes, your policies, and your work site, but then they give you recommendations how you can make changes. And sometimes you're so close to the work, you don't see the opportunities that are available to you. And ultimately, what we're trying to do is decrease the hazards or decrease the risk, right? So our hazards are omnipresent. They're anything that has the likelihood of causing a loss or harm, whether that's facility harm, environmental harm, or worker harm. But our risk is the probability that this harm will occur. So how can we decrease the risk? Either decrease the probability or decrease the consequence. And this is defined really well in the ISO standard. And there's just to remember that there's just some slight nuances to how they define the workplace. The workplace is basically anywhere work is being done. And so, again, an example in the Department of Transportation, we have people who, a lot of our white-collar workers work from home, and we're getting work-related musculoskeletal injuries at home. And so it came to light that we need to do some type of, even if it's remote, ergonomic office evaluations of their home, if we're going to keep them safe, because they're still submitting workman's comp claims because of injuries at their workplace, even though their workplace is at home now. And it definitely puts just a different context or a different spin on it. So some tips. Commitment is the biggest one, as well as your gap analysis. Where are you? Where do you want to go? Integrate into the process every step of the way through great communication, fun communication, not just this, boring PowerPoint, but slides and graphs and figures to keep the management as part of the planning. And so we don't want to overburden management. Maybe we only bring them up to speed 4 times a year, but that they're on board all 4 times a year. And we make it simple so that you can document the evidence that you need that's relevant to you to make your change and create importance. How is this increasing safety and health, decreasing injury and illness rates really important to the bottom line? And so, for example, one of the things that we saw at Boeing was we had so few workers who were qualified to do these highly technical jobs that anything that you could do to keep them on the job and keep them from getting injured actually increased the value to that product line. And, of course, to update skills as necessary. So if you have any questions, you'd have to send them to me. And I hope that you've enjoyed this. And this ends the presentation on ISO 45001, Occupational Safety and Health Management Systems. My best.